If you get diagnosed with vertigo, make sure you say this. Have you been diagnosed with vertigo and been prescribed medication for the symptoms without actually knowing the root cause of the problem? I hear this a lot from my patients, and it leaves many of my patients feeling confused and disappointed. What is the long-term plan? The medications they're prescribed may help, or they may not even help, but definitely a lot of my patients report medication side effects, which makes it undesirable for them to stay on medications for vertigo long term. And then many of my patients are left wondering what to do next. Does that sound like you? In this video, I will share what you should say if you have been diagnosed with vertigo. Make sure you stay until the end of the video so I can share with you the vertigo home remedies that may also help you short term. But first, I am the vertigo detective, Dr. Kim Bell, DPT. I am a licensed physical therapist, and this is a reminder that this video is for educational purposes only. This is not individual medical advice. So, if you have been diagnosed with vertigo, you're probably feeling overwhelmed, confused, uncertain, maybe a little bit scared. Some people feel worried or anxious, and definitely not well. I mean, vertigo, dizziness, nausea, imbalance, it causes a lot of people to miss work, not to be able to take care of their family, not to be able to drive their kids around, not to be able to exercise as usual. And then eventually, if it goes on too long, it can have an effect on your fitness level and your mental health. It just causes a whole domino effect of problems if it goes on for too long. So we don't want that to happen to you. And here are some things you can say to your doctor and your healthcare providers to get yourself fast-tracked to a proper diagnosis. First and foremost, if they prescribe you medications, you want to say, what is this for? What kind of drug is this? What are potential side effects and what are the benefits? Those are the basic questions you always want to ask when you're prescribed medication. And in many cases, taking medication, at least for the first 1, 2, 3 days of a new onset of acute vertigo, is very, very helpful so that people can stay out of the emergency room, stay out of the urgent care, and just try to rest and function the best they can. Not everybody needs medication, but almost every patient that seeks medical care for vertigo is prescribed at least one medication, in my experience. So there are some common drugs that are given to patients with vertigo, but most of them are designed to mask the symptoms, meaning they suppress the feeling, but they don't resolve the problem. So beyond just talking about the risks, benefits, potential side effects of the medication you've been prescribed, the next thing you want to say to your doctor or your healthcare provider is, what is the root cause of my symptoms? That is really the key to prevent this condition from being long-term or chronic, if at all possible. So the question is, what is the root cause? This is what I want you to say if you get diagnosed with vertigo. Okay, thank you for this medicine. I'll take it as prescribed, but what is the root cause? And if you can get to the root cause, which many patients never get to, then you might have a chance to resolve the symptoms, to prevent this from becoming a chronic condition, and to just move on with your life if it's resolvable. Of course, there are certain things that cause vertigo that can wax and wane or recur and relapse, and these are different underlying causes. But in a lot of cases, if you figure out the root cause of the vertigo, it can be resolved with proper care, and then you can move on with your life, thereby probably not needing to take the medications long term. Of course, you should always take your medications as prescribed and discuss any changes with the prescribing doctor before stopping or changing the way you're taking the medication. But many people are prescribed medication as needed. So that kind of leaves it up to you to take it when you need it and have it on standby when you don't need it. The question always is, what is the root cause? And then beyond that, another good question to ask is, can you refer me to a specialist who can evaluate me for the root cause if the doctor or provider you're talking to says they're not sure? So you want to advocate for yourself to get a referral to someone who can help you figure out the root cause if the person you ask says they don't know. Figuring out the root cause can be a process. You might have to get some blood work done. You might need to get a brain MRI. You could need to get some neck x-rays. There's different tests. There's different assessments that patients need sometimes to figure out the root cause. It can take multiple appointments. It can take multiple visits with different specialists, different diagnostic tests, and kind of pulling it all together. And so that is possible. But again, we always want to ask the question, what is the root cause if you've been diagnosed with vertigo? I hope this video has been helpful. Before I let you go, as promised, I want to show you the home remedies that I share with my patients, which can help short term. Okay, so we're here looking at one of my websites, vertigodetective.com. So you can type in vertigodetective.com into your browser. And then if you go over here to the search tool and type in the word remedies, then this article will come up with the home remedies that I share with my patients while they're waiting to figure out the root cause of their vertigo. Remember, the root cause is what's going to drive the treatment plan. So what treatment you need depends on the root cause, usually for vertigo. So again, that's the biggest thing you want to say if you've been diagnosed with vertigo. But in the meantime, here are some tips and home remedies that might possibly give you some relief. First of all, I tell most of my patients, if not all of them, to apply an ice pack to the back of their neck. This would be like along the back of your head, the base of your skull, the top area of your neck, sort of between the ears. And typically it's good to get a nice soft cloth ice pack, because if you happen to fall asleep, it won't give you frostbite. It'll go to room temperature usually within 15 or 20 minutes. Whereas if you actually use a bag of ice cubes and you happen to fall asleep, you could get frostbite on your neck. So typically we want to ice for about 15, 20 minutes, no longer than 30 minutes. Some people will use a bag of frozen peas or frozen corn with a towel over it if they don't have a soft cloth ice pack. But again, don't fall asleep with that on your neck or you can get frostbite. And then typically sitting upright and keeping your head still can help resolve vertigo. For many patients, not everyone, but many patients will get relief if they don't lie down, but they actually sit up and keep their head still. Breathing through your nose into your belly can help to calm down the fight or flight reaction. That's another good home remedy for a vertigo episode. If people are nauseous, I usually suggest for them to eat ginger or peppermint. Both of those are known to resolve nausea. Sometimes it can help to stare at a vertical line or close your eyes. So either one of those may help. And actually, while we're talking about some remedies for nausea, I want to just show you here, if you go on my Vertigo Detective website, if you go to the store, at the very top here, I have my most often recommended products to my patients. This is the Not Now nausea spray. I like to use that myself, and many of my patients like it. And then this is the neck ice wrap that I frequently will give one of these to my new patients so they have it at home, but you can certainly order one for yourself here. So these are my top 2 recommended products for home remedies for vertigo. But again, they don't take the place of seeking appropriate care and finding out the root cause with the help of a professional, because the root cause is what's going to drive the treatment plan. I hope this video was helpful. I'll see you in the next one.